Okay, I want you to picture just for a second the absolute worst day of your life. You've just lost a loved one, and while you're still barely processing that grief, you go out to the mailbox, pull out an envelope, and open it to find an absolutely insurmountable, life-ruining hospital bill. I mean, for most of us, that piece of paper represents years of crushing debt, maybe even bankruptcy. But what if you could fight back? What if you had a tool sitting right there on your laptop that could completely dismantle that bill? Well, welcome to today's Explainer, where we're going to walk through the true story of a family who did exactly that. And I'm going to show you, step by step, how you can use incredibly accessible technology to take total control of your own medical debt.
$195,000. That is exactly where our story begins. A man and his brother-in-law suffered a severe heart attack and, tragically, passed away after spending just 4 hours in intensive care. Obviously, a completely devastating loss. But because he had no active insurance at the time, his uninsured family was just left holding the bag. The hospital sent them a bill for a staggering $195,000, and they owed almost all of it.
Now, what's really interesting about this slide is the sheer incomprehensible mismatch here. We are looking at just 4 hours of medical care weighed against a bill the size of a literal house mortgage. $195,000 for a fraction of a day. It just defies logic, right? But faced with utter financial ruin, this family didn't just quietly write a check, and they didn't ignore it until it went to collections either. They pushed back.
And this was the result. By spending just one single evening using a $20 AI chatbot, the brother-in-law proved massive systemic billing errors. So confronted with the hard evidence, the hospital actually slashed the final bill down to $33,000. Think about that. In just a few hours of work with a $20 subscription, they completely erased $163,000 of debt.
So here is our roadmap for this explainer. We're going to reverse engineer this exact success story into a step-by-step toolkit you can use yourself. We'll hit 1. The $163,000 victory. 2. Securing your itemized bill. 3. The 3 AI prompts. And 4. Free tools and escalation.
Section 1. The $163,000 victory. Finding the errors. Let's break down exactly what that $20 chatbot found hiding inside that bill.
So the man took the bill, opened Claude, which is just a standard $20 a month AI chatbot, and pasted in the itemized charges. Within minutes, the AI flagged an absolute goldmine of violations. We're talking duplicate charges, we're talking supply costs inflated anywhere from 500 to 2,300% above standard Medicare rates. I mean, unless they're using solid gold bandages, that's insane. It caught services billed as inpatient when the patient was never actually formally admitted, and incredibly, phantom procedures, charges for things that apparently never even happened. To be absolutely sure, he ran the exact same bill through ChatGPT, and both AIs agreed perfectly. So he compiled all of this into a 6-page dispute letter, and that is what triggered the massive reduction.
Section 2. Securing your itemized bill. Getting the right data. Okay, let's dive into this, because before you can unleash AI on your debt, you actually have to get the right raw data. You know that standard summary bill the hospital mails to your house? The one with broad categories like cardiology, $70,000. Yeah, that document is completely useless for AI analysis. You cannot find line item errors in a broad summary. You actually have to legally demand the itemized bill, which is a line-by-line breakdown that includes specific procedure codes. So the trick here is knowing exactly what to ask for. You need to call your hospital's billing department and read them this exact script. I'd like a fully itemized statement with CPT codes and quantities for each service. Under federal price transparency guidelines, they are legally required to provide this to you. Now, some places might stall or play dumb. If they do, just hold your ground and keep asking. Oh, and if you have insurance, make sure you grab your explanation of benefits, your EOB, from your insurer too. Now, once you have that golden document in your hands, you're almost ready. But we have to talk about privacy for a second. Before you paste a single thing into an AI like ChatGPT, Claude, or Gemini, you have to protect your identity. You need to redact your social security number, your date of birth, your full name, your medical record number, and your insurance member ID. Just swap all that out with a placeholder, like typing bracket name, bracket. You absolutely do not want to feed your sensitive medical identity into a public AI tool.
Section 3. The 3 AI prompts. Instructing the machine.
This is the core toolkit. Let's walk through the exact copy-paste prompts you need to analyze your bill. Okay, prompt 1. This one is designed to hunt down overcharges and duplicate billing. You're basically telling the AI to compare your bill against Medicare reimbursement rates for your specific state because Medicare acts as a really solid standardized baseline. You're instructing it to flag anything billed wildly over that, like 200% above it, and you're asking it to specifically sniff out services that were billed once as a bundle and then sneakily billed a second time as individual parts.
And what you get back is a super specific list of inflated and doubled up line items. In fact, in that $195,000 story we've been following, this exact prompt revealed that roughly half of the entire bill consisted of master-level duplicate charges. Half. The AI simply spots patterns that a human eye, especially a tired, stressed human eye, would easily miss.
Next up is prompt 2. This one is all about context and common sense. You're asking the AI to look at the length of your stay, look at the specific hospital department, and then flag charges that simply don't make medical sense for that scenario. You're literally hunting for things that probably never happened.
And honestly, what the AI hands back to you here can be pretty shocking. You'll get a list of highly unlikely items. For example, getting charged for the use of a ventilator when you only had a same-day emergency admission, or maybe consultations from specialists that have absolutely nothing to do with what you were diagnosed with. It basically flags the absurdities hiding in the billing codes.
Finally, prompt 3 turns all your findings into a weapon. Because, look, you don't have to be a lawyer to write a killer dispute letter. You just command the AI to draft a formal, professional, firm letter to the billing department. You make sure it cites those specific CPT codes it found, the Medicare comparisons, and targets a specific, reduced dollar amount. What you get back is a ready-to-edit, ready-to-send document. And here's why this is so powerful. When a hospital billing department receives a 6-page letter absolutely loaded with actual medical regulations, specific CPT procedure codes, and hard data, it immediately proves to them that you've done your homework. You're no longer an easy target for them. You're an educated patient holding the receipts.
But wait, we need to pause for a crucial reality check here. AI is amazing, for sure, but it's not perfect. Sometimes it experiences what we call hallucinations. That's when the AI might confidently just invent a CPT code or a Medicare rate that completely doesn't exist. So before you mail that letter, you absolutely must do a quick Google search of the flagged codes to verify they actually match your procedures. Because if you send a letter citing completely fabricated data, the billing department is going to toss it in the trash immediately. Trust the AI, but verify the data.
Section 4. Free tools in escalation. Alternative strategies. Now, maybe you're thinking, I really don't want to mess around with copy-pasting prompts. Or maybe the hospital is just stonewalling your letter. Let's look at your backup plans.
If you just want to automate the whole shebang, there are some incredible free tools out there built by patient advocates. First, there's Counterforce Health. You just upload your bill, and their AI generates a full appeal with medical citations in under 60 seconds. They actually boast a 70% reversal rate. It is fantastic for hospital bills. On the flip side, if you're fighting your insurance company over a denial, fighthealthinsurance.com lets you paste the denial and it spits out a ready-to-send appeal letter. And the best part? Both of these are totally free.
Let's move to and see how this builds if the hospital simply ignores your brilliant AI-generated letter. Here are 3 concrete escalation steps for the real world. First, ask the hospital for a financial assistance application. By law, most of them have to offer charity care, but they are absolutely not going to volunteer that information. Second, call the Patient Advocate Foundation. They can actually assign a free case manager to negotiate on your behalf. And third, if you found phantom charges for services that literally never happened, well, that's fraud. Take your AI-generated document with all those specific codes and dollar amounts and file a formal complaint with your state attorney general. Make it their problem.
Look, most people who get a giant medical bill usually just blindly pay it, ignore it until it destroys their credit score, or they get locked into some miserable payment plan. But the Family and R Explainer didn't do that. They spent one single evening asking a machine to check the math. So I'll leave you with this provocative thought. If a simple $20 chatbot could uncover $163,000 in quiet errors in one night, what exactly is hiding inside your last medical bill? It is time to stop paying blindly and start checking the math. Thanks so much for joining me on this explainer.